You don't like gay people? Too bad. You're an emergency nurse. You still have to take care of them. You don't like
Absolutely.
Nazis? I don't like Nazis, but I have to take care of them, right? Because that my professional obligation is to take care of every patient, right? Professional ethics have to supersede personal ethics. If they align, awesome. That's great. No conflict. But when push comes to shove, professional ethics has to take
Trump.
over.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement because we all know emergency nurses have the best stories. Now, here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from Art of Emergency Nursing. And for this episode this week, I'm doing a crossover episode. I record a second podcast with Dr. Lisa Wolf. If you don't listen to that, you should. It's called How Not to Kill Your Patient. And in this episode of Art of Emergency Nursing, I'm taking that episode we recorded because it's such an important conversation to have that I wanted you to hear it on this podcast as well, just in case you don't listen to both. So if you listen to this one on Art of Emergency Nursing, then you don't necessarily need to listen to that one on How Not to Kill Your Patient. But do listen to this episode. This episode is about moral courage. And if you're in the ER Nurse Tribe Facebook group, then you may have participated in this study anyway. So if you did, that's awesome. Here are the results of the study. So for this episode, I have my friend Dr. Lisa Wolf, the amazing Dr. Lisa Wolf, and we are talking about moral courage in a restrictive environment. Enjoy the episode.
So this study is about moral courage, and it comes out of our initial study about how emergency nurses manage obstetric care in states with abortion bans, right? So we published that, me and my colleagues, so me, Hannah Noble-Wolf, Mike Callahan, and Michael Moon, published this study about a year ago, maybe last September. And every single person in that study talked about what we would ask them, like, so it's illegal now to do X. What would you do if a patient came in with an ectopic or with a, bleeding out, but they just still had a heartbeat? Like, what would you do? And they're like, we would take care of the patient. We would absolutely take care of the patient. And I was like, well, what does that actually mean? Right? I don't know what that means. And there's this huge cognitive dissonance between I would do X when X will get you fired and thrown in jail, right? So we thought, like, there's people are talking a lot about moral courage, right? Acting with moral courage. And so we thought,
Define what that means for the audience. Uh, define what moral courage means.
right. So moral courage is acting in the best interest of in this case, a patient or a colleague when your own position is at risk. So moral courage requires doing the right thing, but also where there's risk, right? So if you're the sort of person like I am, where you return the shopping cart, right? You're doing a moral good, but you're not putting yourself at any kind of risk. So that is not a morally courageous action. It is an ethically appropriate action, right?
Oh my
So
God, everybody needs to hear that.
right. You're not, a moral giant, if you do
Right.
the right thing when nobody, it's like what you do when nobody's looking, but also what do you do when it puts you in a position
When
of
your
risk?
ass is on the line.
When your ass is on the line. Yeah. When your job is on the line, when your reputation's on the line, when your friends are on the line, all of that. So,
One of the things I've always said is, what's her name? The one that got arrested
oh,
for not
Alex
Rubble,
Rubble,
Wubbles.
Wubble. Okay.
And the idea that she got arrested, she stood her ground and she got arrested for it. And it all turned out good for her. And shout out to Alex Wubbles. If you're listening to this podcast by chance, I still want to interview you because that's moral courage. Like that's the
Correct.
very definition, like defiant, even as she was getting her handcuffs put on and getting put in the back of the police cruiser. She was like, you're not drawing blood on my patient.
Right. Exactly right. And that's exactly like, that is a moment of moral courage, right? That is a terrific example because there was definite risk, right? And so we thought, like, okay, let's talk about this. Let's explore this problem a little bit more because it's going to be important, right? as things change in the world, like standing up for what is ethically appropriate is going to be harder and harder. Like there's going to be more and more risk to that. So what we
Yep.
did was we decided to do this. So this is a study I just did with Hannah Noble, who is a PhD candidate at University of Albany who studies abortion law. So she and I have been working together on this. Full disclosure, she's also my daughter. So grow your own research team is my advice to all of you out there. Just grow your own team.
Just grow your own researchers. There you go.
Cheeseburger and a pizza, right? Like,
Yep.
so you don't have to pay them a lot. So what we did was a mixed methods study. So we found an instrument that's valid. It's called the Nurses Moral Courage Scale. Self-explanatory. That comes out of Finland. So we wrote to the author. We're like, hey, this looks really cool. Could we use this? And then she was like, yeah, sure. Awesome. So we did that. And so we gave that to like 75 people, emergency nurses, where we just recruited online and stuff. And so it measures sort of these 4 dimensions of moral courage. It measures compassion and true presence, moral responsibility, moral integrity, and commitment to good care. And so it runs into, it's a good way, it's a valid tool. It's been, it's good for self-reported data, right? It's a self-report. And this is where things get really interesting. So we administer this, 75 nurses take it. Thank you all who did that. Shout out to everybody who took this survey. And so unsurprisingly, more than 70% of the sample was like, I am morally courageous. I act with moral courage.
Who's going to say
times.
they don't?
Right. Who would say they didn't? Right. But some people actually were like, maybe not so much. Right. So we found that, people with a variety of religious affiliations, right? A lot of people identified as Christians, either Protestant or Catholic. Interestingly, 23% of people identified as atheists. Shout out to the atheists, right? 1% Jewish and 16% identified as other. So that could be a whole bunch of different things. Yeah. Most of the sample was white, 20% were Black or multiracial, 91% had taken an ethics class. And this is this becomes important later on, right? So also half the respondents were in a state where reproductive care and or gender affirming care was limited, right? So states with abortion bans, states with gender affirming bans, comprise like more than half of our sample, which tells you the state of the United States right now. So, looking at the scale, right, starts off on a scale of 1 to 10. How often do you act with moral courage, right? Mean score was 9.5 out of 10. So people are like, I totally act with moral courage. But then we get down to this idea of what does that actually mean, right? So the last question on the survey that we asked were, if you encountered a serious ethical problem at your workplace, right? What would your action be? So of the following, would you bring up the problem would you talk about it, right? Like, would you discuss it at work? Would you file a report, like an internal report, or would you file an external report? Would you be like a whistleblower? And only 13% of people said that they would notify outside entities. 21% would file an internal report, but fully 66% of people said, like, I'd talk about it at work. Maybe I'd bring it up.
Yeah.
Right. And so we go back to like the shopping cart thing. Is it ethically appropriate? Absolutely. Is your job on the line? It depends. Depends on where you are.
Maybe.
Depends on who you are. So I would say, rather than like people don't really do anything, depending on where you are, bringing it up for discussion can in fact be an act of moral courage. So I just want to like throw that out there.
And I guess it kind of depends on, I don't know. I think there's a lot of nurses that feel, and I've never felt this way, and I've never felt that my job was like on the line. Like my job was that tenuous that just simply bringing something up would give someone the opportunity to let me go.
I would gently ask you to consider your positionality. You're a straight white guy.
That's a good point. It's a good point.
Right? And where, straight white guys get fired for bringing stuff up, they're much less likely, So yeah. I think I don't think that you're wrong. I think that probably you have rarely been in a situation where your job is on the line. But if I said the same thing, or if a black woman said the same thing, the response might have been different.
Gosh, I hope that's not true,
We know
but
it's true. We know
I
that's
don't know.
true.
I hope not. I guess I myself would tie it more to my position. Like good nurses are hard to find, but certainly there are the inherent values of having a penis. I mean, like,
Right. And a white one at that.
and a white one at that.
Indeed. Exactly right. So yeah, I mean, there's definitely that, and this is an important thing to hold on to. So buckle up, and because now we get to the qualitative findings, right? So we did some testing. Claire Simon, our epidemiologist at ENA, was kind enough to run some numbers for me. Shout out to Claire. Significant differences between anybody, right? Like there was like no pattern between who responded what, right? So not the ethics class, not race, not religion, not age, not experience, not gender, like nothing, right? So then we're like, well, this is all really interesting, but I'm really interested in seeing how people consider their personal versus their professional ethics and how that fits into how people decide to act, right? Because moral courage is an act, it's not a thought. And so we interviewed 8 nurses who agreed to be interviewed in like small groups, right? So we either did individuals, or we did like groups of 2, maybe one group of 3. And so we asked them, like, under what conditions do you see moral courage as being necessary? And how do your personal ethics fit into that? How do you see professional ethics into falling into this? And I got to be honest with you, like, people did not know what professional ethics were.
Hmm.
They were like, yeah, those are the policies, right? And I was like, have you not read the ANA Code of Ethics? Have you not, like, this is the guiding principle for our profession, right? So there was this confusion between personal and professional ethics. And so hold on to that, right? So we start talking about, give us some examples of like what's going on. Do you work in a place with care limiting legislation? Do you work, what's going on? And so we had 5 of the 8 nurses worked in states with bans, right, of some kind. And the other 3 worked in states where there weren't abortion bans, but they worked for Catholic systems.
Mm,
And I know you and I have talked about this, where care is limited, but there's kind of like ways around it, right?
yeah.
So it was really kind of interesting. And so we used situational analysis, which is like a grounded theory method that I use with these really like complicated social sort of phenomenon. And so people talked about the role of experience in moral courage, right? So you and I, we've been what we do forever, and good nurses are hard to find. And we're more likely, perhaps, to speak up about something that we find objectionable versus newer nurses who might be afraid to speak up. And people talked about like professional relationships as a barrier, right? To calling out morally bereft behavior, right?
Ah.
So some nurses talked about how they felt that speaking up about practice violations or stuff was like betraying their family, right? They saw
Mm,
their physician colleagues and their nursing colleagues as a family, and to call out their behavior would be seen really as a betrayal, right? And so the barriers to moral courage actually turn out to be more social and
mm.
financial than ethical, which is
Oh.
really interesting.
In
So people in the study, especially now keep in mind, right? In the survey, like 9 out of 10 people were like totally morally courageous. I always act with moral courage. And what we're hearing from the way that these 8 nurses are sort of triangulating this idea of moral courage, the more experienced nurses were like, yeah, I say what I said, right? But they were also still very hesitant to report anything
mm,
because, again, we are in an environment of the golden handcuffs, especially if you've got your 30 years in, you're like 2 years away from retirement.
Yeah.
Are you going to say something that puts your job at risk, right? Or it has, the potential for some retribution or whatever. So there was definitely that.
So we're morally courageous as long as the risk is not too
Correct.
great. Whether that's risk from the job or risk from the family. And if that's the case, then maybe we're not as morally courageous as we thought.
You got it. Right. And the thing is, and so before we start feeling really bad about this, right? I mean, we should take it a moment and be like, whoa, that's a big problem, right? Because
It's a
once
thing.
again, we're identified as the most ethical of professions and this and that, right? But are we really?
As long as it's not going to make Betty mad at you.
Right. And that's it. Like the social piece of it, which I've been studying for 20 years, right, is exactly that. Like, these are my friends, right? I spend holidays and weekends with them. I don't want them mad at me. So why would I bring up something that is, going to piss off Betty? Exactly right. Other things are like the financial stuff, right? So, as we've talked about before, a lot of times nurses are the sole support of their families, right? And so the financial uncertainty of speaking up, their obligation, they see their obligation as to their families, to the people that they're supporting, not necessarily to their patients. And I would
Mm.
gently remind all of us that our professional ethics is a duty, right? This is a super Kantian structure, right? Like the nurse will. That is your professional obligation. You are duty bound to that code of ethics once you take your little stethoscope, right? Once you put RN after your name, put your little stethoscope on and go to work. Those are the governing things of your profession. And if you do not adhere to them in a court, like a lawyer will read you the code of ethics and say, why did you not adhere to your own code of ethics? And if your answer is, well, just it didn't vibe with me, then you're in the wrong profession, right? So now we have to think about, how do we, first of all, make people aware that I think more explicit ethics education is required here for our colleagues.
But wait, you said they all took ethics classes.
91% of them did, in fact, take ethics classes. So, like, I teach ethics. And so I'm really clear about this. So I'm not really sure what people are taking away from there. Have you taken an ethics class? You took an ethics class, right?
I think, yeah,
I think
I
I
did.
did.
Yeah, I took an ethics class, but I don't remember that. I do remember my medical ethics class. In my medical ethics class, I was me. I was the obnoxious me, and I would always take the opposite side of anything we were discussing. Like I'd be like, kill them all. It's fine. No big deal. Just to start an argument, just to start a discussion, just to piss people off mostly.
Did it work?
But it always, every single time. And really rational, calm, nice, sweet folks would be enraged at me. And I would be like, I would just take like a terrible position, like, oh, kick a puppy. Nobody cares. It's not a big deal. It's just a dog. Nobody cares. And they would be just beside themselves. And I'd be like, I'm just kidding. I'm not that guy. But my instructor loved me because I would always do the opposite of what everyone else was doing. Because everyone else would be like, yeah, they'd give us these scenarios. And I remember there being a lot of scenarios and a lot of discussions. But it was early enough in my career that I don't remember, like certainly wasn't a nurse, when to me, like that seems like the better time to have that ethics class would be, maybe a year into practice.
Right.
Maybe a year into practice where you've had to deal with these situations. Maybe you've had that moral weight of saying, well, what's the right thing here?
And I agree with you. Absolutely. Well, I think you should have continuous ethical education, right? Because the nature of what you become ethically sensitive to changes,
Mm.
right? I
Okay.
think in class, so
We're saying the same thing. You're saying it much smarter than I am. But
no, but think about
that's
like in a pre-licensure ethics class, it's all about like the
what
dyadic
ifs.
relationship, right? Like the doctor won't tell the patient they're dying, or the the baby who's not going to live, and are we going to withdraw life support, right? Like it's those very like big, gigantic things, right? But to me, and what we found in our study of moral distress, good 8 years ago now, is that it's the environment itself that's morally distressing. And right, because you can't provide care in the way you want, because you're understaffed, because you're undertrained, because there's too many people, because everybody's dying of COVID, right? Like there's all of these things. And so there's a couple, I think, really important things around that. The first is that people really saw administrators at fault, right? As like these silent actors, right? In the dynamic where they just disregarded ethical concerns, right? Yep, good luck. So you'll just have to work harder, right? But I don't have enough band-aids. Like I don't have enough angiocasts. I don't have enough. Well, you'll just
Masks.
have to be more careful, right? Like that kind of thing.
Yeah.
And so the nurses describe this almost like moral crescendo, right? Which is described. This is why I was kind of hoping to have Adam Booth here. He talks about moral crescendo, distress, right? But it's in the distress. Whereas these nurses like built up to a crescendo of courage, where like each little insult to patient care got them madder and madder to the point where they would actually act. So
It's
it was like
so
they
it's
didn't react to a specific incident, but to a cumulative, like
it's
straw that breaks the camel's back kind of
yeah,
thing.
the straw that breaks the camel's back, the nurse that loses their shit because they can't find their pen. And
Right.
you're like, it's not about the pen.
Right. It's absolutely
You know?
not about the right. Exactly right.
So-
But they're sort of like, why would I bring anything to administration? Why would I bring up an ethical concern to an administration that has so clearly disregarded any obligation, any ethical obligation to nurses or patients or the community or whatever? Right?
I got to tell you, I hear this every day.
Yeah.
I hear this every day.
Right.
I
It
hear
becomes
this.
normalized.
Yeah,
Like,
I
what are
hear
you
this
going to
every.
do? Right.
I hear this every day in the when the nurses are like, well, why would I tell the director about this? Like, they don't care. They don't give a shit.
Right. Right. Exactly right. You totally normalize this sort of ethical, there's sort of just dismissal, right?
Mm.
And so another thing that I think fits into this that's really important is burnout. And I know we did a podcast about burnout. And what burnout does in this context is it decreases ethical sensitivity. Like people don't even recognize ethical violations in care or in circumstance. They don't even recognize it because they're so burnt out. Like they can't.
Yeah, there's like they just don't have anything in them.
They have nothing left to. They have no fucks to give, right? Because they're so burnt out. But that means that these terrible conditions are allowed to continue, right? It's so we are again violating our professional ethics when we do not call these things out. Now, that being said, the institution that creates an unethical environment of care is also violating their professional obligation. But I think the fact that none of the nurses in this study really understood what professional ethics were is mildly concerning, because that's the weapon we have, right? Here is a standard of behaviors and conditions that we ascribe to as a discipline, right? As a profession. And you're all just, yeah, well, whatever. It's the policy, right? And I'm like, no, it's not the policy. It's not what the policy is. And the idea of professional ethics means it supersedes your personal ethics. And that's the important part, right? You don't like gay people? Too bad. You're an emergency nurse. You still have to take care of them. You don't like
Absolutely.
Nazis? I don't like Nazis, but I have to take care of them, right? Because that my professional obligation is to take care of every patient, right? Professional ethics have to supersede personal ethics. If they align, awesome. That's great. No conflict. But when push comes to shove, professional ethics has to take
Trump.
over, right? It has to be of a higher priority. And it's not. It's not at all in this study.
Wow.
Yeah.
Hey,
What are your thoughts on that?
Gosh, I'm a little bit shocked.
I kind of was too.
I would think that it's easy for people to say, I'm going to act with moral courage, but when it risks getting your family, your peers pissed off or risking your job, that they're like, maybe I won't say anything. It'll be okay. And I guess I'm not shocked, but I can't imagine that. And that had to be like, how do we address this? Like, how do we remind folks of their professional ethics and that their professional ethics supersede their personal ethics? And again, you can, we're nurses. We have to do what we have to do, whether you don't want to take care of that person, whether you don't like that person. Like you mentioned, I don't like gays. I don't like Nazis. If you get one in the trauma bay, we're doing this.
And so I think now, mind you, we're talking to people who work in places where there is care limiting legislation, right? So what would you do if your patient was bleeding out and nobody would do anything because that would be an abortion, right? Like, what are you gonna do? I would take care of the patient. Well, here's the thing. That's illegal. So what actions do you think are appropriate here that fulfill your personal and professional ethical sense of duty, right? I mean, it seems so again, like I go back to this idea that professional ethics are duty bound, right? They're duty driven, which means that there's kind of no exception, right? You must take care of patients in a respectful way that respects their autonomy, right? No matter what, right? Like it's deontological. It's not like, well, unless it's inconvenient for me, or oh, unless I think that the patient really needs this, right? It's not it is not negotiable in the way that people are talking about it. And I think like so one person I had said like so and this is somebody I think who was in maybe Idaho, which has a complete ban, right? And very few OBs at this point because of those bans. They flew what 6 people out to Washington State in the first 3 months of that ban. They helicoptered them over the mountains, right? And so, they said if somebody came in and they were dying of an ectopic, they had an ectopic that was threatening their life, I would probably do what I could to help save them. Okay, how would you do that? Because I wouldn't tell them to leave. I'm like, okay, that's good. Step one, don't throw them out. But what do you do? Do you, we ask people like, what would you do if a patient, needed care that was not being provided in your state? Would you not, nobody even said like, I would flip them the name of a clinic somewhere, right? I would like, nothing. Just I would take care of them. Like, how would you do that? Right. And
Yeah.
so this inability to bridge the gap between this idea that I would do what is best for my patient.
And what does that look like?
What does that look like? Exactly right.
And to what risk?
Right. Right. Exactly right. And a lot of people were like, it was really interesting. They were like, well, I feel if my personal ethics don't align with with the professional ethics, I would go with my personal ethics.
Oh,
I'm like, well, you could do that like in your house, but at work, you are subject to your professional ethics. And I think we present as educators, I think we present ethical education as like this nice thing that we talk about rather than this thing that you live every day, right? Like you have to live your moral convictions every day. That's your job, right? And if you feel as though the ethics that govern your profession aren't really that important, I would gently suggest that you are wrong. Because those are the ethical beliefs you will be held to in a court of law and before whatever deity you believe in at the end of the day, right?
absolutely.
So,
Wow. Now
yeah,
that I didn't expect to hear.
yeah, it was kind of weird. And that's, back from like a research geek perspective, like this is really interesting information, right? It's really important to know that there's this huge gap between what people understand the ethics of the profession to be and what they actually think that
Are.
they're governed by, right? Or what
Uh,
they actually do, and the barriers, right? The social barriers, the financial barriers, the institutional barriers to acting ethically. There's a lot of barriers that are not just individual, right? There's a lot of systemic barriers. And so what we see is that, these findings really align with a lot of other work that we've done on like bullying and bias and stuff like that, where people are so afraid of being targeted that they will kind of just watch stuff go down, right? People said that in order for them to act, in the case of a patient who needed abortion care and wasn't getting it, that we're now dealing with like EMTALA. Like, I don't even know what's going to happen there when Texas has decided and Idaho has decided that EMTALA doesn't apply to pregnant people. So, so what do we do in that stage, right? What do we do as a profession, right? And everybody's, I'm just one person, I'm going to lose my job or whatever, right? But what do we do as a profession other than be guilty bystanders and watch people be harmed, in our vicinity? So what people talked about was like, if I saw somebody suffering harm, like directly in front of me, like if it was my patient, then I would probably advocate more aggressively than if it was like over there. Certainly, people I have never met out there in the world, the patient population doesn't really figure into this calculus because in order for them to be personally motivated to do something, right? Whether it's to report, I mean, I'm not talking about taking over and like grabbing the methotrexate and giving it to the patient. I'm talking
yeah.
about reporting it, right? There's a ton of journalists out there, right, who will highlight these sorts of things and bring public pressure to bear if that's, what you think is appropriate, right? But like not allowing the good of the patient either now or in future to drive the way that we approach the profession means that we are complicit in really harmful practices.
Wow.
It's big, right? I mean, I think I have wrestled with this for weeks as I've written this paper, as I've run it by some folks, and it's a big problem for our profession. It's a problem where we put people in a position where we tell them that they are ethical and must act with moral integrity. And then we put them in positions where that's really practically impossible,
Mm.
right? And the fact that people are so burnt out from other stuff that they're not even upset by this is really significant to me.
Yeah.
I
That
mean, I'm angry all the time. Like, this is why I run, because I'm angry all the time about that. But I also have the
how
luxury of not spending 36 hours a week in an ER, right?
yeah. How did you keep it together during these interviews where you're like where I'm sure you had to be like going, "Oh my God, like what are
I was
you,
like, that's
what are you
interesting.
doing?"
Tell me more about this. Like, what do you think about this? Because the thing is, it's like when you're actually doing the interviews, you're okay, here's a thread. Like, I want to pull this thread and see where it leads, right? So there's a lot of that. It's like when you go back and read the transcript before you analyze them, you're like, wow, like, wow. And then you read 8 or 9 in a row and you're like, wow, this is consistent, right? Like this is consistent across geography, gender, experience, you know.
And one thing I'm curious about, and I don't know if we put this in the podcast or not, but like were some of these had to be people that professionally at some level. Like were there anyone that you were like, I fucking thought I liked you, and maybe
Well,
I don't.
the thing is, I still like all of them. Like I did know 1 or 2 people, and because they're awesome and they do my studies and I love them for it, right? But I gotta be honest, I think what struck me more deeply in these people was how difficult it was. Like you could see the struggle. Like I know this is the right thing to do, and I can't do it because
Mm.
of X, Y, or Z, right? And so I understand the profound difficulty of acting with moral courage, right? It's a lot harder to put yourself at risk when you're the one that everyone depends on, right?
It's a good point.
So I,
I,
so I have
I,
a lot of sympathy for this.
I mean, as the breadwinner for my family, it's one of those things where like I probably shouldn't get fired. And as easy as it is, and I said this earlier in the podcast where I'm like, you're a nurse, you'll get a job, you know, and even then, like there's always a gap.
Right. Tell me about this gap in
Yeah.
your May.
Yeah. Or the like, hey, or this is gonna be a month where I'm looking for a job or in between jobs, and that's gonna suck. I've been there and it does suck. So I'm sure those are the kinds of things that make it just a little, it's gonna
hard.
take some courage.
Like, also imagine like you're immersed in your work, right? Like you're doing great stuff. And then this thing happens and you're like, this is bad. Maybe is this a watch and wait to see if it resolves? Is this a like, hey, what are we doing about this? Or is this a, you know, peace out, I'm out of here, right? And I actually have jobs over ethical concerns, but they were like the side gig. They weren't the main job. I have not been put in a position, fortunately, at this point, where I have, cause to leave my current job for, ethical shenanigans. And that's great because I like my job. And I'm also, you know what? I'm also, 5 years from potentially retiring. So, I have a lot, I have less to lose, right? Because I'm older and I've got, you know, the money in the bank,
Yeah.
right?
Mm.
But I'm the sole support of my family,
Yeah.
pretty much, right? Like my kids depend on me still. They're in various stages of young adulthood. But I think also, I feel like in the same way that like I study workplace violence. So when I get kicked upside the head by a patient, I got to own that, right? If I'm going to study moral courage and document the challenges to moral courage, I feel in a way
Better
that
fucking live it.
I got to walk the walk, man, right? So believe me, if I leave a job, I'll let y'all know why, right? Yeah, I think there's positionality, there's privilege, there's all kinds of reasons why it is easier or more difficult to speak up, which does not negate, like, you gotta have your Spartacus moment where everybody has to be like, "This is wrong, and this is why we have strikes, and this is why we have walkouts, and they can't fire you all at the same time, and they can't arrest all of us at the same time," right? So, there's power in numbers, there's power in disciplinary action. It is really challenging to act as an individual with moral courage because so much is on the line, right? So, but working with a group of people, with a unit, a union, a hospital, a system, right? All the nurses together, we have a chance.
Absolutely. Absolutely.
Get old, get radical, right? But it's so infuriating because now emergency departments are places where harm is legislated, right? Now the place where we go to help, this gets me so angry. The place where I go to help people is now harmful to them for a variety of reasons, right? Depending on who they are and what kind of care they need. And I find that an insult to the profession. And this is where I think nursing needs to really stand up and demand the ability to practice ethically according to our code of ethics, which, by the way, you can actually access online. You can read it. You can look it up.
We'll put a link to that in the show notes as well.
Right. Nothing
The
super
ANA Code
radical
of
about
Ethics.
this. Honestly, friends, there is nothing radical in the code of ethics if you've gone to nursing school.
No.
So
We need an ethics 101 or an ethics 102. Maybe that'll be a podcast we do sometime of just,
sure.
hey, here's a little ethics update.
Here's a little ethics update, right? Absolutely. I'm teaching ethics this summer. Oh,
Maybe-
policy and ethics.
Maybe we boil that down and make that a little mini series. I don't know how many episodes that would be, but 6. You're like, I already know. You're like, I already got it.
Yeah. Well, there's sort of understanding, like, what's ethical language, right? And I think that's the important part of taking an ethics course, right? Is so that instead of being like, well, that's not right, like you can actually talk about the ethical principles that are being violated, right? And in what ways? And then you sound like you know what you're talking about and you're making an academic argument, which for some reason people respect more than going like, "Hey, that's not right, this is bullshit, but this is why, because you are violating the principles of justice and veracity and all that kind of stuff," right? Um, so that kind of language, I think, is really important to use it when I teach ethics. That's what I really want to give my students is vocabulary that you can use in your letters to the editor, right, about this. A second thing is really thinking about what are the ways that we think about ethics. Just go through the ethical principles, right? There's like 10 of them.
Yeah.
But, what does it mean like in practice? What are some of the things where it's going well or it's not going well, right?
What's the next step for the study? Is there a next step for the study? Is there something?
Yes.
There's
Actually,
always a next step for you.
there's always a next step, right? So the study that I'm doing right now with a colleague of mine, like this is like the OB arc, right? This is the abortion arc, is about communication, medical legal communication in emergency departments around care limiting legislation, right? So every single person I have spoken to across 3 studies now, if I say to them, "What's your administration told you about your practice, how this affects your practice?" They're like, "Nothing, radio silence," right? Even you. Radio silence, literally nothing, nada, nothing in writing, no communication, nothing. I'm like, "You just cut off care for a huge part of your population." Like, they didn't tell you? Like, you don't know what you can tell patients, you don't know what you can talk to physicians about, like, you don't know whatever, and they're like, "Nope, I have no idea." So
Mm.
so there's 2 pieces to that, right? One is, like, what came out in this moral courage study, people were, "Well, if this is the moral backdoor argument, right? Well, if I don't know that's a problem, I don't have to worry about it, right? No, sorry, my bad, right? Ask for forgiveness rather than permission.
Always.
Right? So there's for a
Mm.
lot of nurses, they're like, I don't want to know because my practice has not changed and I don't anticipate it changing. And I don't want to know because then it would have to change. Right. So there's that thing. I had people say, like, it's the obligation of the administration to tell me what my limitations are. And I'm like, ignorance of the law probably is not going to protect you at
Yeah.
the end game, but okay.
Yeah. I was gonna say, I tried that with speeding, and
Right.
it didn't really work out. I tried that once in Austin during the ENA meeting when I was riding a scooter and blew through a red light and didn't realize that on a scooter you're supposed to obey traffic laws. The officer was not impressed with my lack of knowledge of the law.
There you go. Right. So,
Mm.
yeah. So there's definitely that. And so I think that there's a certain security in not really knowing anything, right? But so this third study that we're doing is really exploring what do people know? We're in data analysis now, right? But like, how did people find out about the law? And we're talking specifically mostly to people in states with care limiting legislation, but we're talking to some people who are like from Maine and they're like, oh yeah, our CEO sent us an email saying that we would be accepting patients from other states for all these different types of care, and we were gonna take great care of them, and it was gonna be awesome. And I was like, on my way to Portland. So, like, love you guys. But the states with bans, they were like, we know nothing. We heard nothing. Our administration is saying nothing. We don't talk about it at work because going back to this idea of like social pressure, nobody really knows. How do people know that someone's a safe person to talk to? Right? Like if you come in with your little pronouns pin on your badge, I feel comfortable talking to you about this problem, right? What I see to be this problem. People were talking about they know about the laws because a friend or a family member had either a fetal loss or a fetal anomaly or something that they required care and they couldn't get it. Um, so there's a real personal link to what's going on for some people, but for people who don't have any personal connection, they're like, I don't know, right? I don't know what it was. But this lack of communication, you talk to people about, so if you're going to do a change to your door to EKG process, how would that get communicated? And people are like, well, we get an email, we get a meeting that's in the bathroom, we got to sign off. It's like all this stuff. And I'm like, interesting. Why do you think this is different? And they're like, wait a minute.
That's a good question.
A great question. So that's the next study that we're working on. Hopefully that will come out, by December.
Very cool.
Wild stuff.
Now, where can people see that? Where can people read this paper?
So this paper is going to be published in Nursing Ethics. So, because I'm doing this work at UMass, this is sort of the next thing. But I think the study I'm doing with my colleague, who's a linguistic anthropologist, I think we're going to end up publishing it, at least the nursing part, in the Gen, and maybe the anthropology part, like in another journal. So there's a couple of papers that come out of that study.
Very cool.
Yeah.
Very cool.
So how we talk about things in healthcare is really interesting. No different that, like, you'd think like, oh, there's a practice change. People should know about it, right? But in this case, no.
Radio silence.
Radio silence. Fascinating.
Absolutely. So I can't wait to read the paper. I can't wait to share this with folks and make sure they're thinking about these things and having these conversations. Exactly. So, well, thanks again as always. Amazing.
Cool.
So,
Yeah, we'll talk again soon.